The president signed an executive order earlier this year specifically aimed at helping those who have served our country in the military to get access to mental health care at VA hospitals. Connecting Point's Tina Martin brings us the story.
Suicide is a big issue.
Vietnam War veteran Thomas Kane has studied the effects of war on society for decades.
Last year, over 7,000 veterans committed suicide. That's more people than soldiers were killed in Iraq and Afghanistan and globally in the war on terror over the last 17 years.
To address those high suicide numbers, President Trump signed an executive order in January allowing all veterans access to mental health care. Prior to the order, care was only available to those who served in combat or had a service-related disability. The order specifically targets veterans in the first year of transition from military to civilian life because
that's a high-risk window for suicide. So anything that we can do to help veterans make the transition smoothly from their active duty service to their civilian life and VA care is a good thing.
Dr. John Bradley is chief of psychiatry at VA Boston, which currently treats around 65,000 veterans a year.
1/3 of the veterans that we care for have a mental health condition or substance use disorder. So these conditions are prevalent.
And many veterans struggle with drug and alcohol abuse for years before they seek treatment, like David Johansen, a Navy combat veteran who was discharged in the 80s, but was only recently diagnosed with post-traumatic stress disorder and bipolar disorder.
I didn't know I had it. You know, my world's been ruined with drugs and alcohol.
Johansen was eligible for help because he's a combat veteran and says his treatment has been a lifesaver. Now he's hopeful that all veterans will be able to get the help they need.
And there's a lot of injured minds out there, you know, that have to be taken care of.
Tom Kane is hopeful too, but he worries about the lack of specifics in the plan coming out of the White House and whether VA hospitals will be able to handle an influx of patients.
They're going to have more people seeking services, hopefully, and also need for more staff, professional staff, trained counselors for these. And that's a question that I have about whether there'll be funding and human resources made available. I also think that there should be some aspect to the program that provides support for family members of veterans.
Kane says diagnosis and treatment can get complicated, and many veterans suffer from more than one issue. So while he thinks the executive order is a good start, he also wants to see access to treatment extend beyond a year.
Many of these problems don't come to light until after several months or even years after they've been discharged, and their substance abuse problems or post-traumatic stress starts creating bigger problems in their life.